what exactly is cellulite? So cellulite, of course, from the outside is the dimpling that you see. It is a lot more common in women than it is in men. Actually, you practically don't see it much in men at all. So you see it very, very often in women, and it's in pretty much almost all women. I mean, seriously, it's about 9 out of 10 women will have some degree of cellulite at some point in their life. So extremely common, all right? And it can be anywhere from mild to moderate to severe, okay? But from the outside, what you see are those dimples, right? Those dimples or divots, which take away from the smoothness of the skin, okay? But what's actually causing those dimples, okay? So what's causing those dimples are these septae, okay? We call them septae, but you can think of them as fibrous bands. So you actually have these bands that are inside that are attached to the skin. So this here is the skin, and then the underlying, and then you have your muscle underneath there. And so these septae or these bands are attaching the skin to the muscle, and then these bands become tight, and so they actually kind of pull the skin in and create this divot. Okay, so you have your cellulite dimple or cellulite divot because these bands are attached and pulling things in. And so then, a lot of people ask, why do you see more cellulite as you gain weight? Well, because the bands don't change size, right? But if the band's not changing size, but what's going around the band is, right, it's going to become more visible, right? So the band never changed, but what changed was the fat around the band, okay? So as you gain weight, then yes, cellulite is more visible. And if you lose weight and the skin remains tight, then the cellulite will become less visible, but it would not go away because these bands, they never go away, and that's just genetic. You're basically born with them. There's nothing that you can do, right? So it's not that you did anything right or did anything wrong. Cellulite is pretty much genetic, and like I said, it happens in most women. 9 out of 10 women are going to have some degree of cellulite throughout their lifetime, okay? So any cream that you see out there, and people are trying to sell you cellulite creams all over the place. Any cream that you see out there that you put on the top of the skin, that you're going to be putting on top of the skin here, it's not going to do absolutely anything for you. Please do not waste your money. They're basically scams. There is no cream out there that's going to fix cellulite because it doesn't go to the root of the problem. There's no cream that you put on the outside that's going to do anything to these fibrous bands on the inside, right? So really the only way to treat the cellulite is to do something about those bands. And so what Quo was trying to do, which was the injectable, that was an enzyme that would eat up the bands and break them up. But unfortunately, Quo had a lot of side effects with excessive bruising, which left these dark, pigmentation on the skin, and therefore people were not liking that part of it, and it was taken off the market. But the Avéli is a completely different concept. The Avéli is this device that we have right here. You can see the device there, the Avéli device. And so what we do is that we put the device just underneath the skin, okay? And you take it to where those bands are. You then deploy the little blade that it has inside, and you pull back on the device, and you basically cut off the band, okay? So that's what you're doing with the Avéli. You're going right underneath the skin. You're pushing that, past the bands. You deploy the knife, and then you pull back, and you cut the bands, all right? And what we found is that each cellulite dimple is not just one single band that's causing it, all right? Because that would be relatively easy, but it's actually like typically multiple little septae. It depends on the dimple. It can be 4, it can be 5, it can be more. Okay, and you have to be able to release all of them. So the other thing that the Avéli has, and this is a demo, so you're not going to be able to see it here, but it has a little light source at the end, and it tells you exactly where the tip of that device is, so you can then go around the dimple and cut all the bands. And sometimes it does take more than one. So it's not just like one time, cut, and then you're done, because you have to make sure you release all the bands. And this is in a 3-dimensional pattern, right? Not just like in the whiteboard here. So you go in, you cut all the bands, you release them. And once you release the band, then that skin is now released and it's able to go up, and then you no longer have the dimple. All right, there's no longer a dimple, so that skin, which was being kind of tied down with a band, you release the band, the skin is able to come up, the dimple goes away, and you have a lot smoother surface, okay? Now, the great news about this is that once those bands are cut, they don't come back together again. So it's a permanent solution to cellulite, okay? In that whatever area that you treat, in that specific area, it's not coming back. Okay. Now you could have cellulites elsewhere, right? You may have bands elsewhere. You gain weight, you may see those, and then you have to get treated again. But that one that's got treated, that's it. Those bands are cut forever. Okay. So that's the great news. The other thing that I found since we've been using this for several months now, and I do, as you all know, a ton of BBLs. Probably the most ultrasound guided BBLs out of anyone in the U.S. The other thing that I found is that not only does it work for cellulite, which of course a BBL is not a cure for cellulite, but sometimes I've used it to help with well-defined flat spots or dents, which are not necessarily cellulite, but they're very, very similar. They also have these attachments underneath there that need to be released. And so I found that I can use the Avéli device, the same device, not just for the cellulite, but also for some defined flat spots and dents that I see sometimes in the BBL after your BBL. Okay, so typically the next question becomes can you do it all at the same time? If you have a few, so I'll call it mild cellulite, in a few specific well-defined dimples, then yes, I'm okay with doing it at the time of BBL. However, if you have moderate to severe cellulite, or multiple flat spots or dents, okay, then I do not recommend doing it at the same time as the BBL. I typically recommend doing the BBL first, and then you can come back at around 3 months to do the Avéli cellulite treatment then. If you want to do it the other way around, it's possible. I think it's best to do the BBL first though, all right? So that's typically a very common question. So if you don't know the answer, you're like, well, doc, I don't know. Am I mild, moderate, severe? I don't know, right? Of course, then just send in your evaluation, right? Send in your questionnaire, your evaluation. I'll take a look at the photos, and I'll let you know what I think is going to be the best recommendation for you. Okay? All right. But there's a couple of things that the Avéli device does not do, right? So in the similar fashion that a BBL is not a cure for cellulite, the Avéli device does not cure other things that might be going on. So one of the things that might be going on is that you have skin laxity. All right, you may have some looseness to the skin or loss of elasticity to the skin in the buttock and thigh region. And so then it makes it appear like it's cellulite, but the main issue is not cellulite, but that the skin is loose. And so when the skin is loose and it hangs down, you see more divots, lumps and bumps, and irregularities or unevenness in the skin. Okay? When you have unevenness or lumpy bumpiness in the skin due to skin laxity, the Avéli device is not going to help. Okay? It's not going to help because the issue there is that the skin is loose, not that you're getting these bands, these septa that are holding the skin down. Okay? And the other thing that the Avéli device does not help is lack of volume, right? So if you have volume, if we need to add a volume, as you know, there's two ways of doing that. One, of course, is with your own fat, which is essentially a BBL, fat transfer, right, to the buttock or hips. Or if it's small and defined, we can use Sculptra, which is a great filler for the buttock and hip area. Okay, and the Sculptra is a great solution when you have kind of smaller areas that require volume. So what we found, as we've been using this for the past few months, is that a lot of women have a little bit of all three going on. So they have the cellulite for sure, but they also have a bit of skin laxity and in certain areas, a lack of volume. And so the best way to kind of really treat the area is to have your complete booty makeover. That's right. We're doing a booty makeover. We're combining modalities so that really give that area, the best, most, youthful appearance. Okay? So we can use the Avéli to treat the cellulite, and then for the skin laxity, we can add some Morpheus 8, which is a microneedling on steroids with a radio frequency. That's going to help with the skin laxity. And then for the specific areas where you need a little bit of volume, we can add the Sculptra. And the great thing about all of this combination right here is that no anesthesia required. You can do it right here in the clinic just under some what we call local anesthetic. Local anesthetic means that we numb up the area, okay? And then once the area is numb, then we can provide all these treatments for you, okay? Done right here in the clinic. You know, depending on how much you're doing, the appointment can take anywhere from 1 hour to 2 hours. But you come in, there's no need for labs or fasting or any of that stuff. You come in, you get it done, you go home, that's it. Slam bam, thank you ma'am, right? Think of it. Think of it like this way. You can either do it during your lunch hour, you have like an extra long lunch, right? Or towards the end of the day, or perhaps Friday towards the end of the week, right? You go get out of work a little early, come to the clinic, get it done, go home for the weekend. Okay? Great. So these are the things that we can do in the clinic setting. Now, if you have quite a bit of skin laxity and we're doing something in the operating room already, of course you can add body type to that. Or if you have quite a bit of a lack of volume or really adding a lot of volume, we can then do your BBL. Okay? All right, so I think that kind of explains everything in a nutshell, if you will. But I'm happy to take any questions about this or any other plastic surgery topics.
Okay, there's any downtime after the Avéli?
That's the great thing. There's really no downtime. So you can literally have it done during lunch and go back to work, okay? Are you gonna you may feel a little sore. Yes, okay, you are gonna see some bruising, but you can go back to work, you can go back to all your regular activities. The only thing that that you are gonna see is there's gonna be bruising there, right? So you may not wanna plan like your Christmas pool party right afterwards, right? Because there's gonna be some bruising to the area. Usually resolves over the first week or two, and then the results will start to get better and better. We typically are seeing kind of more finalized results around 3 months post-op as well.
Is it permanent or how long does it last?
Yeah, that's a great thing. So once you use the device here, you kind of put it into that area and you slice through those bands, and that specific spot, they don't grow back again. Okay, those are released and they're released forever. So it is a permanent solution for cellulite to the spots that are treated.
Okay, let's go to it. I had lipo with J plasma done a month ago.
Okay.
Those cavitation and radio frequency affect the J plasma?
So I think it helps if you need it, right? So not everyone needs cavitation and radio frequency, but sometimes you need to add that to really improve your results, okay? So my recommendation is, of course, you can speak to your surgeon, show them your progress, and also speak to your qualified lymphatic massage therapist, which I think actually really is the most important because they employ those those modalities, right? So there are some patients where you do your lipo and your J plasma and they just need just a manual massage, maybe sometimes some wood therapy, and that's it. There are other patients where there's certain spots where they may start to be developing perhaps a little bit of fibrosis, and we want to try to prevent that, in which case the cavitation works well. And then if you need a little bit of extra help with the skin, the external RF energy will help as well.
Okay. If you have a large amount of weight loss and may not have enough fat for a booty makeover, can that product be combined with my fat? I guess she's talking about Sculptra.
Yeah, so it can be kind of added to it. Again, Sculptra is something that you don't want to use for large volume expansion, okay? Why? Because it would get ridiculously expensive, to be honest, like much more than a BBL will, because each of those vials are kind of expensive from the company. And I'm not talking about what the surgeon charges or whoever charges, it's the vial itself, okay? But if you do your BBL, right, and then after you've healed and you're settled, you say you're about 3 months out, and there's like a specific area where you want to add more volume, say like your hip dip went from like say what it was to 90% of where you want it to be, and you just wanted to get that one little bit more, then yeah, you don't have to do like a whole entire other BBL. You can add the Sculptra and really get that nice kind of filling and get things rounded out, and it is possible to combine that on top of your BBL.
Do you recommend massages after the surgery?
So we're talking about lipo and BBLs 100%. Okay, I know today, 2023, there's still some surgeons out there that are doing lipo and not recommending massages, and honestly, I don't agree with that at all. I think you definitely need massages, and you need quite a bit of them. So I would recommend a absolute minimum of 20 massages after your lipo 360 BBL to really optimize your results and to have the best outcomes.
Can you have this, the Avéli, done with a mommy makeover?
Yeah, so if you're coming for surgery already, we can certainly add that on. And we can add it on to pretty much any procedure. So like I said, the only one where we have to really do an evaluation is if you're having your BBL and you have like moderate to severe cellulite, in which case it's best to stage it. But say for example, you're coming for your mind makeover and you have your defined dimples, we can add that on. Typically what we do then is we start with that, and you'll be under general anesthesia, so you're not going to feel anything. We start with that, we treat you with the Avéli, then you get turned over, and then we proceed with the mommy makeover. It can be added to any breast surgery, any like straight up liposuction surgery, pretty much almost any surgery.
Okay, do you recommend massages after a mommy makeover?
Definitely. So I also recommend massages after the mommy makeover. So for the tummy tuck aspect of it, you can start your massages right away, but the initial massages are going to be to the flanks, okay, and the waist area, and also to the lower back. Why the lower back? Because a lot of times you develop some tension in those lower back muscles as you're walking kind of hunched over like this for the first week or two, okay? So we definitely recommend those massages there. Sometimes for the breast, after about 2 weeks, depending on how the implants are looking, we may recommend some massage for the breast implants as well.
Okay, going there. Okay, would you recommend fat transfer to the breast instead of breast implant? Which is safer?
So I think in terms of safety, they're both very, very safe procedures. I wouldn't say one is necessarily safer than the other. Now, I personally prefer the breast implant. Why? Because I think the breast implant can really alter the shape of the breast and really create that nice round look to the breast, okay? And of course give you more volume. Fat transfer can only give you more volume. It's not going to change the shape of the breast, okay? And you're limited as to how much volume you can give. So as opposed to say the booty, where we can easily put 1,000 up to 2,000 cc's in the booty because it's a large area with a robust blood supply, in the breast you typically can't put in more than 200, maybe 250 cc's in the breast, okay? So think about it, that's like a 250 cc implant. How many people are out there putting 250 cc implants? Very, very little, right? We're typically doing 300 up to 400 and sometimes more. So you're very limited as to how much volume you can put in with the fat transfer to the breast. Another issue with fat transfer to the breast is that sometimes because that blood supply is not so robust, you have a higher incidence of fat necrosis or fat cysts, which are not necessarily something that's going to affect your health, but when you start doing your screening for breast cancer, and we are in breast cancer month right now, right? We're on Pinktober. We are, you're going to have to start doing your screening, and sometimes when you do your mammograms or your ultrasound, these areas of fat necrosis or cysts can look a little bit, suspicious, and then you have to go in and get a biopsy to make sure that it's not a breast cancer, okay? So for all those reasons, I'm not a big fan of fat transfer to the breast, and I think the best way to give volume and alter the shape and create a pretty breast is with the use of a breast implant.
Okay, we have a lot of people on TikTok, and one
TikTok.
question there said, do you do Botox and fillers?
Botox and fillers, yeah, of course. So we have, part of our Pure is the Pure Aesthetics Center, and we definitely do Botox and fillers here. We have our nurse practitioner, Jenny, she's awesome, and our physician assistant, Natalie, also great. So they'll take care of you. They'll do your Botox, they'll do your fillers. They can do the Avéli. They can do Morpheus. They can do Sculptra. All sorts of things we can take care of here at the Pure Aesthetics Center.
I'm glad you're going over this. I decided to do implants and now glad I did. She got surgery. No, she will have surgery on October 13th, your patient. So
All right.
in a couple days.
That's it. You're coming up soon. All right. I'm looking forward to seeing you here soon.
Do you do thigh and arm lifts?
Yes. So thigh and arm lift, we perform those as well. So the term for the arm lift is typically called a brachioplasty, or technically called a brachioplasty. Okay. And then your thigh lift is, just your thighplasty. That one's a little more straightforward. But what it is you're removing excess skin of the thighs and the arms, and this is typically after a weight loss. So we have a lot of patients that lose a significant amount of weight, especially nowadays with the with the injectables, the semaglutide and the Mounjaro. These are great ways of losing weight without the need for bariatric surgery. And we've had patients that start on these medications, they'll lose 20, 30, 40, 50 pounds, and then of course they're going to have loose skin. So when the skin is moderate to severe in terms of its laxity, then the best way to treat that is to remove the skin with an arm lift or a thigh lift. Okay, so I certainly recommend that. I think the arm lift is a great procedure. It's very common. With the thigh lift, I would only really reserve that for like the more severe cases, because that is a tougher surgery to recover from. Okay, a lot of times we can have, we can deal with like wounds or seromas or other issues, and the patient just needs to be aware of what may happen after a thigh lift before they embark on that journey, although the end result is, it's going to be a huge change for them.
How long does it take for transferred fat to completely integrate into the buttocks?
So I would say about 6 weeks, or at least we want to be careful for the first 6 weeks, okay? And that's why I ask all my patients to try to avoid pressure to the areas where we did the fat transfer for those first 6 weeks. So that typically you're laying on your belly, and if you do say you're using that special BBL pillow, all right? After 6 weeks, whatever fat was going to take has taken, whatever fat was going to be lost and absorbed has been absorbed. And so at that point in time, it's okay to then start sitting, and you shouldn't be losing any additional fat. From that point on, what becomes more important is the feeding the fat. So we still want you to quote unquote feed the fat up until your 3-month mark. Make sure you're increasing that calorie intake. You're eating healthy fats such as avocado, eggs, and red meat, and salmon. Okay, and then if you need a little boost, you can do some milkshake and ice cream. So that's great up until the 3-month mark.
Will a very active person just burn the fat off from a BBL lipotransfer?
So you have to be careful, right? So like I just mentioned, you don't want to be super active certainly in the first 6 weeks. Ideally in the first 3 months, okay, and you want to be feeding the fat for those first 3 months so that we can get as much of that fat that we transfer to take and to survive and to plump up, and you can get visited by the quote unquote fluff fairy. Okay, once you've done all that, all right, then after 3 months, if you want to then start becoming more active again, that's okay. And just know that the areas where we did the fat transfer are going to start to react in a similar fashion to the rest of the fat in your body. So if you're gaining weight, you're going to gain weight there as well. And if you're losing weight, you're going to lose weight there as well. Okay, but the distribution, the way that the fat was redistributed from the Lipo360 and BBL, that distribution will remain, and you won't go back to the distribution that you had before surgery.
Can you elaborate on the burning sensation? Why would there be burning? Does it cause death?
Does it cause death?
Yeah.
No. No. No, it doesn't do that. But it is common after big lipo case, Lipo360, to as you're recovering, to experience like burning sensations like in the skin or underneath the skin. Okay. And why is that? Is because of course a lot of little tiny nerve endings are disrupted when we do the liposuction. And then so those little nerve endings are essentially pretty raw and they're hypersensitive. And so then that gets kind of sent as a message to your brain that it feels like a burning sensation, okay? That's something that will get better and resolve over time, okay? And the best way to help that along is with massage. So when you have a nerve that's hypersensitive, the best way to desensitize that nerve is to actually rub on it. Okay, so massage helps, compression helps, and time helps. And if we do have a few patients where even with massage and compression and time, they're just like super sensitive. Sometimes we also give them a medication called Neurontin or gabapentin, which helps with this type of pain, which we call neuropathic type pain. Now, is it going to lead to anything dangerous? No. Does it lead to like death? Absolutely not. It has nothing to do with that.
What's a good BMI for a tummy tuck and fat transfer to the hip dips?
So, for me personally, I think you want to be of a BMI of 30 or less. Okay, really for the most ideal, long-lasting results, and to decrease also the risk factors for the surgery. Okay, know that as your BMI starts getting above 30, the risk factors begin to increase, and certainly if you're close to 30, 35 or above, I think the risk factors are way too high, and I would not recommend any surgery from anybody with a BMI of 35 or above, and certainly not a tummy tuck with fat transfer to the hips. But if your BMI is 30 or below, then you're a good candidate.
Did I hear you mention that you can loosen tight skin with Avéli during a BBL?
So not necessarily loosening tight skin, okay, but if you have a fairly defined flat spot, meaning like not the entire side of you is flat, right? But there's a flat spot that we've identified, okay, then I have been able to use the device to release some of the bands underneath that spot to help it pop out a bit more, okay? So in that sense, it does help.
Do you do awake lipo?
No, unfortunately, no. Here we do all of our procedures under general anesthesia, all right? And I really think it's a lot more comfortable for the patient, and you get a better result because awake lipo hurts. I know, that you're supposed to use, you get the tumescent fluid and everything else, but the fact is you don't get rid of all the pain. The patients are like moving around, they're squirming. The surgeon is like apprehensive. You're not being as aggressive as you want to be. So I would not recommend that. I think in order to get the best results and to be the most comfortable throughout the procedure, it's best to use general anesthesia.
Last one, Doc.
Last one.
Yes, sir. Can you help with medical weight loss for high BMI patients?
Yeah, so that's great. So we introduced the semaglutide, 2-3 months, no more, 4 months ago?
Yes.
Yes.
Maybe, I guess.
Okay. So we've been offering that for the past at least 3 to 4 months. We do offer what's called semaglutide, which is the injectable. So an injection that you put in once a week, that's it. And the way that it works is that it basically decreases your appetite, decreases your cravings, and you get full faster. All right. So overall, then you're taking less calories and you lose weight. I think semaglutide and similar medications are revolutionary. I mean, there's really not a need for anyone to undergo bariatric surgery anymore. Bariatric surgery, I'm talking about gastric bypass, gastric sleeve, etc. You don't have to do these invasive procedures anymore. You just take the little injection once a week and you're going to lose weight like that. So we offer it because, as you know, I have fairly strict BMI limits. And so before we would just tell patients, hey, do your best, try to lose surgery. But now we can actually help you. So if you're above my BMI, all right, then still give us a call. We'll help you. We'll get you started on the semaglutide. That's going to help then decrease your weight to the appropriate BMI. And once you're at your appropriate BMI, we can then proceed with surgery. Okay? All right, everybody. Well, that was great. I hope you all enjoyed this. I'm really looking forward to our weekend here with Avéli down at headquarters somewhere in California. So stay tuned for that. Okay? And I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. Ciao.